This is a demonstration on how to do manual lymph drainage on someone. Will use your right arm with who has lymphedema in the right limb, most likely from breast cancer treatment, but could be from something else. And so we're going to go through the process. We're not going to do a full treatment. So we begin by assessing the abdomen and assessing the turgor. So when I'm just assessing your turgor, are you okay if I say what it is? That there's some restriction right here. But the thing is, the left side of the body has more mesocolon types of structures. So you have the sigmoid mesocolon here. And then in here, you have the small intestines, right? That's attached to the back wall through the mesentery. And then up here you have another. So I'm actually feeling more restriction in this area and then around the colon. So just something for me to keep in mind when I'm doing the treatment.
Yesterday, that was the side that was really hard to get into.
Okay, right. So I'm not off track, right? Okay, so the next thing that we're going to do is begin with doing circular movement, stationary circles for the space between the neck and the clavicle. And so what I'm going to do is just take a small region of my hand, but I don't want to use my fingertips. If I use my fingertips, then I'm going to be digging into tissue, and it'll be like I'm working on muscle, not on lymph. Remember, we're working superficial and under the skin.
And this is for the right side involvement.
This is for right side involvement, right? So we're going to do the neck for both sides, right? All right, so it's gentle circular movement, and it's really slow. So this is following more of a traditional type of treatment for lymph drainage. All right, so gentle, slow, circular movements. And then remember, what I want all of you to do today is when you're doing this, to time how long it takes before you feel that you're very parasympathetic. In other words, very relaxed. I'm curious to see how long it takes. So she's asking counterclockwise or clockwise. Do I have this on? Yeah, I do. All right, so it doesn't matter the direction. And I could go the opposite direction. Now, one thing that I started finding early on after I started receiving, learning matrix repatterning, was that how the tissue felt under my hands. So in other words, I would be moving in slow circles, and then I would feel each time I got to a certain point that it was restrictive. And so then I thought, well, what should I do about that? So I'm going to go and see that. I mean, there really isn't, there's just a tiny, tiny bit of restriction on her. It's actually right there. And so then I would hold it and let it release. And so, like at this point, since it's so minor, it's already released. And she's probably going to start going parasympathetic now. Are you feeling that? Like just more relaxation? Yeah. All right, so that's feeling really good, and we're going to move on. So normally, so the other thing is I would get up close to the patient, or have the patient move to me, but we're only going to be here for a second. And so then, this way, I'm reaching across her body. All right, and this side is really flexible, movable, and lymph should be flowing there. So I'm going to go back to this side, and I'm going to use this hand. Now, you could do two hands at the same time, but it's not a comfortable position to be in as a therapist. However, if you did it from this angle, say sitting, then I would use the thenar eminence and do slow circles this way. But it's not as comfortable for the patient. But this is the most gentle for the person. Could you feel the difference between me trying to use both hands? Mm-hmm. Yeah, compared to this is more comfortable. If you want to do both, you can come in with your hands. Now, for some people, they don't know what to do with their thumbs, and so they're trying to figure it out, putting their thumbs on their neck. And so you need to keep your thumbs relaxed, and I like to just kind of keep them off to the side. Worst case, so you're using your thenar eminence like this. All right? And then that way the thumbs are out of the way, and it's still gentle. Okay, so the next thing is we're working on the right upper arm, and so we need to clear lymph node group regions. The next place is the abdomen. And here we have the descending colon. And so I like to follow the path of bowel movement, right? So if we want to help support bowel flow, then we would do the descending colon first, or say the sigmoid colon. So you have to be careful when you're on the abdomen because some people have abdominal pain and you don't want to go too deep that it's hurting them. So the important thing is to be looking at the patient, and then you're going to use your hands. Now normally I would go to that side of the body, but for the sake of demonstration I'm going to stay here. And so we're going to use some pressure, and you see I'm watching, make sure she can handle how much I'm doing. It's better if you do it skin on skin. And now look at my body too. Remember we talked about how you want your body to move? Because otherwise I could stand strong and be rigid and then do this. And what's the difference?
Painful.
Painful.
A little bit.
Yeah, a little bit painful, right.
Like a pinch.
Yeah. So now I'm moving my body and it flows a lot better for her. And so if I'm feeling restriction, which I am here, and I'm going to find exactly where that is, like right here. So now I'm just going to hold it there.
Change of pattern. It's not my schedule, my daily schedule. That for 3 days different schedule.
You mean for constipation?
Yes.
Yeah.
Mm-hmm.
Right. Yeah, we get off schedule, and so we kind of have to be easy on ourselves. Like, well, I didn't go today, and I didn't go yesterday, but maybe tomorrow I'll go. Right? And if we don't stress out over it, we're more likely to have bowel movements than if we stress out over it. All right, starting to release. You feel it softening? And I can tell because her body's just sucking me in. And so now I'm going to continue with my circles. And that flows a lot better. There could be more done on it. In other words, there's a restriction right here. So I'm just going to hold that one too. We're in New York City, so we can hear the cars. So now I'm getting some release, so I'm going to actually follow the release. Yeah. So I'm not going to move a lot, just, let it move to where it wanted to be. There we go, and now I'm being sucked in. All right, so I'm going to go back, and all right, so we actually were working on the sigmoid colon, so now we can work on the descending colon, and we're going to do circular movements. So just by doing that, the sigmoid colon, spending a little bit of time on it, it's going to help with the remainder part of the colon. And quite often, there's restrictions in the colon, or around it, I should say, not in it, because we're not working in the colon, we're working around it. So remember, we're creating space, we're improving circulation, releasing fascial restrictions. And keep in mind too that the ascending and the descending colon go very deep, so it's more retroperitoneal than intraperitoneal, whereas the transverse colon is more intraperitoneal, meaning it's more anterior and within that intraperitoneal space. So a really interesting thing to do is to look at the videos on embryological development in the peritoneum. And it's really amazing how it starts. It's like so fascinating. All right, so I'm just kind of moving along the abdomen. I'm not feeling a lot of restrictions, except right here. I feel some. So we're actually going to pass that over because I've already shown how to do a restriction. But normally you would do a number of circles, like at least 10 here. That's what I used to say in the beginning, do 10 circles. It's not enough. People with lymphedema or any type of lymph flow problem, they actually need more circles than 10. So I might spend 20 minutes on the abdomen. Okay, so circles here, and then if I was on the other side of the body, I would come in here at a better angle to get this part of the colon, so the hepatic flexure. And now here we are again at the ascending colon, where it's more retroperitoneal. So the other thing too is when you're doing treatment, to be thinking about where the tissue is located, because then it's really a matter of intention. And when you're thinking deep, then you're going to actually be able to work deep without putting a lot of pressure on it. So I'm just going to do it as an example. So first, I'm just going to be, doing circular movements, like say talking to the patient. But now I want to work deep, and so now I'm going to think in my mind about the depth in the position of the ascending colon. Let my hands go to that depth, and now work. And do you feel the difference?
Mm-hmm.
Yeah. Right, and I can feel it too. Like I can feel where there's a little bit of restriction. So it's on the lateral side of the ascending colon. And then of course you have the cecum here and the ileocecal valve where the small intestines joins with the large intestines, all right? So you could do a little bit there too, but just real gentle. Okay, so that's it for the abdomen. There's breathing exercises that are specific for lymphedema treatment. So the breathing exercises basically creates a type of a pressure so that it increases lymph flow in the thoracic duct. So the way we do it, and by the way, working on the abdomen and for the manual lymph drainage and for the breathing, you want their knees to be bent because that softens it. All right, so come in to the center, right around the umbilicus, and put some pressure, and then I'm going to ask you to take a big breath, and as you take a big breath, and I want you to push your abdomen into my hands. There you go, and let it out, and as she's letting it out, I'm going to move my hand to the inferior ribs. Take a breath in, and let it out, and breath in, and let it out. So you're almost pushing too hard. So you're breathing. So right now you're pushing, and I know I gave you that cue, but it's not the best one. So breathe in, and breathe into my hands. Okay, let it out, and breathe into my hands, and let it out, and breathe into my hands, and let it out, and breathe into my hands, and let it out. Good, okay. So the thing that I realized too is I do have a video, a DVD on how to do this on the whole body for the patient, how to do it on themselves, but it's actually for how to do manual lymph drainage. It's like say you have chronic pain or something like that, so it covers every region of the body. Okay. So now we've cleared the lymph nodes in the abdomen. We're going to do it in the axilla, the contralateral side, and the ipsilateral side. So since I'm right here, I'm going to do it on this side. So just bring this leg down and bring that one down. There we go. All right, so we're going to come to the inguinal region, and the best thing to do is find the panty line or the crease, and then you're going to put your hand right there at the crease. Now, I did have one patient who didn't like it. She didn't like my hand there. And so what I did is I had her put her hand there, and then I did it over her hand. That works. All right, so you're comfortable with it? Okay. So, circular movements.